mynews.studio.
In a country better known for its coral reefs than for advanced heart care, the Maldives is getting closer to performing its first heart transplant. But what does this really mean for healthcare globally?
Today is October 22nd, 2025. Before we go any further, it's important to clarify, despite some headlines, the Maldives hasn't actually performed a heart transplant yet. The major milestones so far have been a coronary artery bypass graft in 2018 and a transcatheter aortic valve implantation in 2022. Both of those happened at ADK Hospital.
Right, and those are significant achievements, especially for a country with fewer than 600,000 people. But how did they get there? The Maldives faced real challenges: limited advanced medical care, too few specialist doctors, and a lack of high-end equipment.
So how did they manage it? They started by investing in infrastructure. They built specialized cardiac care units, and Maldivian doctors received training both locally and overseas. International partnerships were key too. Surgeons like Dr. Ranjan Sapkota from Nepal worked alongside local teams to make those early surgeries possible. Is this approach typical for smaller countries?
It can be, but the Maldives' approach stands out for being methodical. Instead of jumping straight to the most complex procedures, they focused on hitting smaller milestones first. That way, they built up both confidence and skills over time.
But what about keeping these advances going? Complex surgeries need ongoing support. The Maldivian government's 2025 budget actually includes plans to expand services, building new hospitals, upgrading facilities, and adding specialized centers for organ transplants.
Knowledge transfer is another big part. By working with international hospitals and specialists, they're not just bringing in outside help, they're building local expertise. That's essential if they want this progress to last.
So for other small island nations, what can they learn from this? Is it mainly about having enough funding, or is there more involved?
It's definitely more than just funding. Strategic investment is important, yes, but so is developing local talent and building global partnerships. Achieving progress step by step, one milestone at a time, seems to be an effective pattern. Would you say this could work as a model for health systems in other countries?
I think so. The Maldives shows that even with limited resources, real advances are possible with the right strategy. It also really highlights how vital international collaboration can be. Why shouldn't other nations try something similar?
And there's a bigger shift happening. The Maldives used to send patients abroad for treatment. Now, they're starting to provide those services at home. That's a big change, not only for them, but as an example for other countries.
So to sum up, while the Maldives hasn't performed a heart transplant yet, they've set the stage. They've invested in infrastructure, trained their specialists, and built up partnerships to carry out complex heart surgeries. This isn't just about one country. It points to how thoughtful planning can help even the smallest nations move forward in healthcare.
Thanks for joining us today as we explored how a small island nation is quietly changing the healthcare map, one step at a time.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it for free.